Hi everyone, my name is Hannah. I'm a dementia and delirium practitioner here at Watford General Hospital. Thank you for watching this presentation today. Caring for someone with dementia is a journey and comes with both challenges but also some very deep and meaningful moments. This presentation is designed to give you a clearer understanding of what dementia is, how it affects the person living with it, and most importantly, how you as a carer and us as professionals can support them and treat them while in hospital, ensuring empathy, patience, and also confidence. Whether you're a professional carer or supporting a loved one, I hope that this presentation gives you some practical tools, deeper insight, and renewed sense of connection to the importance of the role that you play. Some things that we'll cover today are what is dementia, some common types, symptoms of dementia, diagnosis, communication skills, helpful tips and tricks, and community services. So firstly, what is dementia? Dementia is defined as a syndrome, which is a group of symptoms caused by brain damage, leading to declines in memory, thinking, and problem solving. It's not a normal part of aging, but results from diseases and damage to the nerve cells. It can affect communication and daily life. It is chronic and progressive, meaning that it is lifelong and gradually does get worse over time. Its main characterization is the difficulty with memory, but there are lots of other ways in which people are affected. Dementia is an umbrella term for these syndromes, and there are over 200 types of dementia. On the screen now, you'll see a photo of a normal and healthy brain and a brain of someone who was living with Alzheimer's disease. And as you can see, there's a shrinkage in the size and it looks a little bit more gappy. So we'll go through some types of dementia, the most common dementia being Alzheimer's disease. And this is caused by a buildup of abnormal proteins which form plaques and tangles around the brain cells. And these proteins then deposit and damage and kill brain cells, disrupting chemical messages that transmit signals between them. Vascular dementia is usually characterized by a decline in thinking skills, and this is due to a reduced blood flow in the brain and then causes damage to the brain cells. Dementia with Lewy bodies is again caused by abnormal protein deposits called Lewy bodies in the brain, and this can lead to a combination of kind of thinking, movement, sleep, and mood problems. It can also cause visual hallucinations and some Parkinson's-like motor symptoms like tremors or stiffness. And usually memory loss is not really that prominent in the early stages of this dementia. Basically, the protein is getting misfolded, forming these Lewy bodies, and then causing the brain cells and the neurons to die. Frontotemporal dementia, so this is a fairly uncommon type of dementia characterized by progressive damage to the brain's frontal and temporal lobes, and usually you see quite a lot of personality changes with this dementia. And then there's mixed dementia, so any dementia paired with another as well. So some symptoms of dementia are memory loss, especially short-term memory. So things like being orientated to kind of time and date. They might be forgetting things that you've just told them or instructions that you've just said. But usually long-term memory is intact, so things from the past, things they like to do when they were younger. A lot of people still remember their army days, but not what they had for breakfast. Another one is poor concentration, so they might need more prompting when completing a task. They might not be able to focus on a television program or reading a book anymore. And just generally struggle with maintaining focus for a prolonged period of time. They might have difficulty in planning tasks, so what once was a daily task for them, such as washing themselves, they might not now be able to sequence that task independently and might need a little bit of assistance of what comes next in the sequence. They might have a delay in their comprehension, so often we find this when we're having talking to somebody who's living with dementia, and they might just need that little bit more time to kind of take in the information that you've said and then form a reply. They might have difficulty with language or communication, maybe some word finding difficulties, or just forgetting what the next part of the sentence that they were going to say. They might have some personality changes, and we do see this quite a lot, especially in hospital. And so, the carer or loved one looking after them might say, this isn't them, this isn't how they were previously, and unfortunately that's the disease and not them. They might have mood changes or mood swings, so they might be very happy one moment and distressed the next. Again, we see this in hospital, especially when they're out of their familiar environment. And they may have challenging or inappropriate behaviour, and this can be really, really upsetting for loved ones as well. Diagnosing dementia. So it's very important to know that we don't diagnose dementia in a hospital setting, as normally people are unwell here, that's why they're in the hospital, and patients must be well at the time of their diagnosis. So normally patients are referred to the memory clinic by the GP or the hospital, and the first thing they do is get a very detailed history. So they will ask normally the caregiver, but also the patient themselves, about the symptoms they're experiencing, when they first started, and how they're affecting daily life. Then they do a physical exam to rule out any other causes for these symptoms. They'll do a medication review, so they'll check the medications to see if any of them are causing side effects that could be causing symptoms that are similar to dementia. They'll do cognitive tests or cognitive function tests, and these measure memory, thinking skills, ability to concentrate, and problem-solving skills. And an example of this is something called a MOCA, which is a Montreal cognitive assessment, and they do like those ones in the memory clinic. That's quite common to see. They might then do some blood tests to identify other conditions or other health issues, vitamin deficiencies, thyroid problems, or any infections that can cause dementia-like symptoms. Sometimes they do some biomarker tests, so blood tests that can sometimes be associated with some of these diseases, but they're not routine, and they're very limited in their research at the moment. They might do some brain scans or CTs, MRIs, and sometimes that can show changes in the brain structure, and it can be indicative of dementia, but is not diagnosed dementia. And then sometimes they will do cerebrospinal fluid testing. So this is done during a lumbar puncture, where they extract some of the cerebral fluid from your spinal cord, and sometimes that can look for things linked to dementia. Is normally done in Alzheimer's especially. And then they may also refer to other specialists if confirmation is needed. So in all these testings, it's more ruling out anything else before the diagnosis. Communicating with someone living with dementia. So the first tip is to speak clearly and slowly. Use positive and friendly tone of voice throughout. Keep things simple, so break down complex information into short, simple sentences and focus on one idea at a time. When you're asking questions, maybe opt for a yes/no, or give them two options rather than open-ended questions and asking one thing at a time. Allow time for a response, so allow pauses in your sentences, as people often living with dementia need time to process the information that you're giving them. Make eye contact with them, get at their level, and make sure they know that you're talking to them. Focus on the feelings, because often people don't remember what you said, but remember how things made them feel. Avoid kind of correcting or contradicting them. Don't quiz them on things, and repeat information if you're not sure that they've understood. Embrace the past. A lot of people living with dementia, that's what they can remember, and so reminiscence is really important when speaking with someone with dementia. So here are some helpful tips and tricks that can be used at home to help someone living with dementia. So creating daily routines, trying to keep a routine such as washing and dressing, eating at the same time each day so they know exactly what's going to come on. You could use calendars or to-do lists. Lots of people like post-it notes put around the home, and so that there's events on a notebook or a calendar that they can clearly look at and see what's going on this week. Using verbal prompting when you're doing tasks, so getting them to do as much as they can for themselves and then providing verbal cueing or prompts during the task if they get stuck. And if you need to assist the person, tell them exactly what you're going to do step by step while doing the task. Engage them in activities that they like, so planning activities that the person really enjoys and trying to do them possibly again at the same time every day at home. We have a gentleman currently who loves a puzzle, so that's what we do with him on the ward, and he really enjoys it. It keeps him orientated and safe and comfortable. If you're able to, try and keep them active and promote movement. This might not always be achievable, but try and complete it where possible. Be realistic with the activity and how much can be done at one time. And several kind of short mini workouts might be best, even if this is walking to the kitchen to get your cup of tea and back again. Regular movement throughout the day. Encourage nutrition and hydration, and I know this can be a very, very tricky one as well. So getting a variety of foods and especially things that they like to eat as well. Hydration is really important. It might be that they need a different cup, or they might be better with a straw, or sometimes it is easier if you say, oh, I'm going to have a drink now. Should you have one as well? And mostly they'll kind of copy the action that you are also doing, which is good for you as well. And allow choices, so give them choices, and as I said in the communication slide, giving them a choice of two things is usually easier. So would you like yogurt or crackers for your snack today? Try to remove any hazards or clutter around the environment. Things like rugs or electrical cords, they can be hazardous and potential trip hazards as well. And also just getting rid of the clutter is usually kind of for their senses a little bit. So some helpful tips and tricks for the hospital. The first one is completing a This Is Me document, which you'll see on the screen now. And this is provided by the Alzheimer's Society and available on our wards. So this is a document that helps people looking after your loved one know exactly what to do, what to say when we're with them, and gives us all the information we might need about your loved one. Bringing in photographs for the bedside, allowing the patient to then reminisce of these people and also have a familiar face by their bedside, which will hopefully make them feel a bit more comfortable. Bringing in familiar items or clothing, so lots of people have favourite slippers that they wear at home or a favourite jumper, and just having home comforts in this environment will hopefully make people feel a lot more comfortable. Bringing in their sensory aids, so glasses and hearing aids. Things are difficult anyway without being able to hear or see, so these are really important to bring in for your loved one. And then asking managers for some open visiting on the wards. People who are living with dementia normally cope better when their loved one, when their carer is around, and so this will be helpful if you're able to stay on the ward with them. And finally, contacting our Caring for Carers service. So we have an excellent service in the hospital that provides both emotional and practical advice for people that are looking after or caring for someone living with dementia. So this is the most important slide of the whole presentation, and it's about looking after yourself. So the first thing is that to ask for help when you need it. Everyone is going to need help at some point, and there's no shame in asking for help or assistance where you need it. Take regular breaks for yourself, so whether that's maybe asking a family member to look after your loved one for a little bit of the day, or a sitting service, anything like that, make sure that you have a break for yourself where you do something that you like to do. Making sure you are also getting good nutrition and hydration in throughout the day. Maybe looking for some support groups for who you can connect with, people who's also on a similar journey to you. Spending time with family and friends is also really important, so doing that whenever you can. And most importantly, making sure that you're getting some rest and some sleep. Sometimes it's quite difficult if you're looking after somebody who also doesn't sleep, and therefore you're up with them or you're up worrying about them. But getting sleep is really important in looking after other people and yourself. So I've popped on the slide here about some community services available in Hertfordshire. So the first one is Memory Support Hertfordshire, obviously the Alzheimer's Society, and they have local groups. Admiral Nursing from Dementia UK, Carers in Hearts, and we also have a Caring for Carers service if your loved one comes into hospital, and then of course Age UK as well. And all of these websites have amazing tips and tricks. They have support groups, and they have lots of information and resources that can be helpful and used whenever needed. So I briefly mentioned earlier our Caring for Carers service here in the hospital, so I just want a slide to appreciate them and their amazing service here. So their contact details are on the screen now, but things that they can do, they're kind of there to listen and support for any queries relating to your carer's role. They can support in communication for you as a carer in your loved one's treatment, care, discharge planning process. They are an advocacy service and they can liaise with the clinical staff on your behalf. They can also provide information on things like carers assessment or request one for you. They provide information about, again, the community support that we said earlier on. They can register you as a carer with your GP, register you with Carers in Hearts, help with emergency planning if needed, and a whole host of other things, as well as emotional support as well. They're amazing listeners and a really great team that we have here at the hospital. Thank you so much for listening to this presentation. I hope that it's given you something to take away from this. If your loved one is ever in hospital and you just need a bit more support or have any questions, then please do contact the team. Our mobile number is on the screen and my working hours are also on the screen. And thank you so much for your time today.